All right, today you and I are putting on our detective hats. We're stepping right into the ER to tackle two really intense life or death puzzles. And you know what the key clue is in both? It all comes down to one vital organ, the kidney.
So picture this. We've got two patients, completely different people, but both are in the middle of a sudden catastrophic crisis. And for both of them, it's their kidneys that are just screaming for help. The real challenge here for the doctors is figuring out what those signs mean before time runs out. So how in the world do they pull that off, How do you connect all those chaotic dots from what the patient is feeling to making the right life-saving call? Well, let's find out. We're going to dive right into our first case. Okay, get this. A 64-year-old man is rushed into the emergency department, and he can barely breathe. He is experiencing something called flash pulmonary edema, which is frankly terrifying. It means his lungs are filling up with fluid, and they're filling up fast. Now, he's had this happen before, but this time it's way worse. And the clues? They're starting to pour in. Okay, clue number one. His blood pressure is just astronomical. We're talking 222 over 118. That's what you call a hypertensive crisis, and it means his pressure is so high it could be damaging his organs right now. This is a massive, blinking red flag. Something is pushing his whole circulatory system to the absolute brink. And at the exact same time, look at his oxygen level. It's down to a super dangerous 88%. All that fluid we talked about in his lungs is basically blocking oxygen from getting into his blood. To put it bluntly, he's literally drowning from the inside out. All right, now the blood work comes back and it gives us another huge clue. His urea and creatinine levels, they are way, way above the normal range. Now you gotta remember, these are waste products that healthy kidneys are supposed to filter out. So when they're this high, it tells the doctors, hey, the kidneys aren't just getting hit by this crisis, they might actually be the ones causing it. And then comes the smoking gun. They do an ultrasound, and what do they find? One kidney looks totally normal, but the other one, it's tiny, it's shrunken. Now, why on earth would one kidney be so much smaller? This just screams that there's been a long-term problem with blood flow getting to that one specific kidney. So, let's lay out the evidence, right? We've got insane blood pressure, kidneys that are clearly struggling, and one kidney that's mysteriously small. The team feels like they're getting really close to an answer, but they need one more piece of the puzzle to be absolutely sure. And the next test they choose, well, it's got to be the right one. So put yourself in their shoes for a sec. What's the next move? Do you order a standard CT scan? Do you risk a biopsy? Or is there a better option? What they really need is a way to see the actual blood vessels, the arteries that are feeding the kidneys. And the right call is C, a CT renal angiography. It's a special kind of scan where they inject a dye that basically lights up all the arteries on the screen. It gives the doctors a perfect, crystal clear roadmap of exactly how blood is flowing or not flowing into those kidneys. And bingo, that scan shows them exactly what's wrong. The diagnosis is renal artery stenosis. The artery leading to that small, shrunken left kidney is severely narrowed. It's pinched off. So because that kidney is starved for blood, it gets confused. It thinks the entire body's blood pressure is dangerously low. So it does what it's programmed to do. It floods the body with hormones that scream, more pressure, more pressure. And that's what sends his blood pressure through the roof, causing those flash floods in his lungs. It was a supply problem, plain and simple. Choosing any of the other options would have been a total dead end. A regular CT, it wouldn't even show the arteries. A biopsy? Super dangerous when you think the problem is a blood vessel. And a DMSA scan? All that would do is confirm what they already knew, that the kidney isn't working right, but it wouldn't tell them why. Okay, one case solved. Now let's pivot to our second mystery. This time, it's a 71-year-old man, and he has a history of prostate cancer. He comes in with the complete opposite problem of our first patient. Instead of a flood, his body has just stopped. For the past 12 hours, nothing. He hasn't been able to pass a single drop of urine. So they draw his blood, and the results show a full-blown crisis in progress. His creatinine is 5 times the upper limit of normal, and his potassium is climbing into a range that could literally stop his heart. Because nothing's coming out, all these toxins are just building up and building up fast inside his body. Just like in the first case, they turn to the ultrasound. and it gives them a very clear and honestly a pretty alarming picture. Both of his kidneys are swollen, they're ballooned up because they are full of trapped urine. The technical term is bilateral hydronephrosis, but what it really is a plumbing emergency. The pipes that lead out of his kidneys are being squeezed shut, and the most likely culprit is the cancer in his pelvis.
So you can see how different this is from our first case, right? This isn't really a diagnostic puzzle. They know what's wrong. The question now is all about action. What do you do right now to relieve that dangerous pressure and get things flowing again before those kidneys are damaged for good?
So what's the number one priority? Should they give him IV fluids? Maybe try a standard catheter and see if that works? Or do they need a way to completely bypass the blockage? The clock is ticking, and every minute counts. And the answer is D. The only move that's going to save his kidneys is to insert bilateral nephrostomy tubes. It's a procedure that directly tackles the problem by draining the urine from above the blockage. The procedure itself is actually pretty ingenious. Using an ultrasound or CT to guide them, doctors insert a tiny tube right through the patient's back, directly into each kidney. Think of these tubes like an emergency exit. They let all that trapped urine drain out into a bag, and boom, the pressure is relieved almost instantly. And just like before, you can see why the other options would have been terrible. Giving IV fluids to someone who can't pee, that's a recipe for disaster, just more fluid overload. A regular Foley catheter in the bladder wouldn't do a thing because the blockage is way higher up in the system. And just giving medicine for the high potassium, that's just treating a symptom while ignoring the ticking time bomb that's causing it. So there you have it. We've just walked through two pretty incredible medical puzzles. Both patients came in with what looked like acute kidney failure. But as we saw, they were totally different problems at their core, and they needed completely opposite solutions. Let's just boil this all down to the key takeaway. Case number 1 was a supply crisis. The blood couldn't get in. The problem was upstream from the kidney. Case number 2 was a drainage crisis. The urine couldn't get out. The problem was downstream. See that? Two completely opposite pathways, both leading to the same catastrophic result for the kidneys. And that really brings us to one last thought. These two cases we looked at were dramatic, full-blown emergencies. But a lot of the things that threaten our kidneys, stuff like chronic high blood pressure or early diabetes, they don't make a sound. They're totally silent. And it really makes you think, doesn't it? What other silent conditions could be putting our kidneys at risk right now without us even knowing?